If no dentist wears gloves and they're coming at you with a drill, run. My name is Teresa Elliscar.
I'm Dr. Jennifer Reyes.
I'm Dr. Lucente, and I will be rating films about dentistry.
I would assume that there's probably going to be like an exaggerated truth to what I see. Let's get to it.
Rubber dam and clamp installed?
Yep.
Oh, he's using a headstrom file.
Actually, that's really true. We do use headstrom files for root canal. It's a special type of file that helps us to get things out of the canal. We don't just poke the file though. Usually it's all the way down into the tooth in order to get all of the nerve and blood vessels and bacteria out of the tooth.
Only thing that is inaccurate is that it looks like the patient is able to rinse. He didn't have a rubber dam and the clamp on, but that is something that you would definitely do for a root canal.
And usually dentists don't keep their window open wide enough where a pelican can fly in.
I would say Finding Nemo, fairly accurate.
Can I get a little Novocaine there, Doc?
The dentist doesn't have a mask on, doesn't have any gloves on.
We don't put the syringe up like this. We usually try to keep it out of vision.
We usually use some topical gel before we even use anesthesia, just to kind of alleviate some of that pain.
I just wanted to say there's a lot of good friends of Bill Willoughby in this town, Miss A. No! Ow! Stop! No!
You have something to just like diamond coated that's like really hard, so that and it's moving like 400,000 revolutions per minute, so it absolutely can pierce through your nail. That is one reason why you shouldn't move, because if this can do that to someone's finger, it can cut your face, it can cut your cheek, your tongue. 3 billboards outside Ebbing, Missouri. Accurate that yes, the dental drill can be very, very harmful. What's inaccurate is that the dentist didn't wash his hands, he wasn't gloved. Just the way that he was holding the handpiece was also incorrect.
Most equipment does not look like that. That looked like piercing, tattoo stuff.
Looks like he has like brass knuckles. Sometimes they do go back to some of the older instruments that were used early 1900s, but it still really doesn't look like that.
I don't even know what he's trying to do. He looks like he's trying to take out a tooth, and then now he's drilling.
And we don't wear cooking aprons. Oh, so much is wrong here. Little Shop of Horrors. Oh no, nothing is true there.
Are you a grinder? Do you grind your teeth?
I grind all night.
Laughing gas, most of the time it doesn't make you laugh like this. They're actually more relaxed. Most of the times patients are not talking while they're getting laughing gas.
Turn it up.
No, we're gonna turn it down.
Turn it up.
She's asking to turn the gas up, and I feel like that's fairly accurate. Who doesn't want to be more relaxed when they're at the dentist's office?
This is 40, half true. The whole setup and the way everything looked, he was actually wearing gloves. But in terms of hysterically laughing, I haven't experienced that.
Yeah, that one's gonna have to be filled.
I always have Final Destination moments though when I'm at the office. If someone doesn't sit on the seat properly.
I usually try not to show the patient the needle before I inject them, because the needle's like this long and it's scary.
And usually if we're drilling and we notice that the patient is kind of wincing their face or a teardrop is coming down, that's our indication that, you know, the patient's in pain. We're gonna stop. Say, are you feeling this? Are you in any discomfort or pain?
There's like some smoke that's coming up. That's really not accurate, especially if there's water running. Usually that will help to cool everything down.
And the oxygen tank is running out. Oh my gosh. Okay, no, that doesn't happen. We definitely monitor it. Usually there's a dental assistant in the room that's monitoring the nitrous and the oxide levels. The patient is just getting just nitrous right now. That is not good. That can cause you to convulse, you can vomit, you can literally die. Ooh. For Final Destination 2, none of that is true. It's just way, way, way too out of pocket. It's just dramatic. So hopefully this helps you out for the next time you go to a movie and see a dentist office. Half of it's not true.